Okay, so we're gonna go over the stool and saliva kit instruction. So you've got your box here, and you'll simply just open this up. It'll have everything you need right inside. This form here is considered the lab rec. So this has to make it back in the box when you're all done. The first thing you wanna note is if there's a signature right here, which there should be. Let's say there isn't a signature right here, simply let us know. You can call the office and we can email you a copy, or we can figure it out, have you come into the office. That way we have a signed form, because when you do mail it back in to UPS, we do need a signature there. I can go over the form since I have it handy here. All of this is already pre-marked. You don't need to worry about any of that, but this top box here, this portion is what you will need to fill out some of your information. Your name, date of birth, gender, mailing address, including the state and country, your phone number, zip code. Right here you'll see lab clinic ID that actually is left blank, so you don't need to fill that out at all. And then you'll see a couple questions here. Are you a resident of New York State? You're going to mark that no, as well as was the sample collected in New York State. Be sure that you mark both of these no. If you live in New York State, you are not able to do this test for some reason. Okay, and then the last portion here that you'll want to fill out is your last sample collected date and the sample's shipped on date. As well as refrigerated, because we're going to go over that with the instruction, but all of the samples will be refrigerated after you collect them. So then just the last sample collected on and the ship date, and then also marking the refrigerated portion. And then the next side here, this is the instruction side. So we're going to go over some of that right now. Here's your shipping, so you want to keep that handy for at the end as well. So you've got your vials right here. You have two different sets. The bigger vials are going to be for the stool collection. The smaller vials are going to be for the saliva collection. I'll just move this out of the way here. So I always let patients know that the test itself is going to be over the course of 3 days. The most important thing to know is that you want to have the test done before the start of the next week, because you don't want the shipment to arrive when you mail it out to UPS when over the weekend, or possibly when the office is shut down. So I'll tell patients to start a Friday or Saturday. That way they can ship it out Monday or Tuesday at the latest. All right. I'm going to pull these files out. Now, to go over the instruction form here, one thing to take note of, because this will give you a potential start date for yourself where you'll need to wait a certain amount of time possibly. When you're looking here, it'll tell you certain things to avoid and for how many days. So for example, for your stool collection, you would want yourself or the patient to not take bulk laxatives, stimulant laxatives, vitamin C, eat rare red meat, peroxidase containing foods such as broccoli, cauliflower, even cantaloupe here, for 3 days prior to the stool collection. To follow along with that, for 1 week prior, antacids, bismuth compounds, mineral oil, castor oil, you would want to stop all those for 1 week prior. And then for 2 weeks prior to the collection, antifungal and antimicrobial medications. So those are all things you want to take into account before you set up and start your tests. That way you don't have something in the system, your system, that could potentially skew your results. I always let patients know if there's a question or a concern to let us know by simply calling the office, and we can talk to the provider to get a better clarification for you. And just to go along with that, on this side here for the saliva, the same thing goes. This would be, let's see, right here, 3 to 5 days prior to the collection. Avoid hormonal supplementation, sublingual drops under your tongue, or even pellets. And then also here, avoid all hormones, any type, topical skincare products as well, before the collection for the saliva. So again, any questions, concerns, not sure if what you're taking applies to that, let us know and we'll figure it out. And if we need to wait a certain amount of time before the collection, then we can do that. All right. So these 3 vials here, these bigger vials are gonna be for your stool collection. So I always let patients know to start the test, preferably let's say Friday, that way you can ship out Monday. So the first stool sample is going to be with your B vial. So you're gonna see a little scoop right in here. So that's what you're gonna collect with the sample to put into the vial. I always provide my patients with a hat. So what you do is simply lift up the toilet seat, put your hat in the toilet, put the seat back down, collect your sample, preferably just the stool sample, not with any urine if possible. And you'll just take your little scoop here, unscrew the top. The scoop is connected to the lid, and you'll just scoop the sample. Now, a lot of people think they have to fill this vial all the way full. Not necessary. What you're gonna do is scoop in your sample till it pushes this water up. And when I unscrew this cap here, it's gonna be hard to see, but there are 2 clear lines. It's very hard to see, but there's 2 thin lines. You want that water to be pushed up to this line right here. So it's really not filling the whole vial with stool. It's just simply filling it enough so that the water gets pushed up to that top line. Once you have that collected and the water is pushed up, you'll screw on the lid nice and tight, and you're actually going to label this vial with your name and then the date. And then you put that vial in the refrigerator. All the specimens, once you collect your sample, they have to be refrigerated. So then your next stool sample, on the paper here will say 2 to 3 days later. So what I'll tell patients is to do your first sample on Friday and your last sample on Sunday. So these 2 vials here will be for your very last sample. For that last sample, it's vial B and vial A, and that'll be from the same sample. You won't have to go 2 separate times. So again, the idea is to take your second sample here, put the scoop in and fill that up to the very top line, just like we went over with the other. And the same goes for the pink tube. It'll be the same thing, but that clear line right here, you get that water pushed up, put your lid on tight, put your name and the date, and put both in the refrigerator. So just for clarification, you just need for this last sample with the 2 vials, that is collected from the same sample. And then that completes your stool portion of the test. So you've got those 3 in the refrigerator. Next will be your saliva. So what you can do for the saliva test is do that on Saturday. So first stool sample Friday, last stool sample Sunday, saliva Saturday. So each saliva tube is labeled with the appropriate time of collection, which makes it handy. Now you're gonna see I took out a green vial. That's because you actually don't need to use this. We do not test anything with this tube. So you can simply throw this out. I'm just gonna put it to the side though for us. So the very first collection here is gonna be your morning fasting collection. I wanna go back to my paper here. And the left-hand portion, that's your saliva instruction. So as far as all the collections go, 60 minutes prior, you want to avoid smoking, brushing, flossing, using mouthwash, eating or drinking anything with exception of water. 3 to 5 minutes before your test, that's when you want to get some water and actually rinse out your mouth before you collect the sample. So right here, you're going to see the breakdown of your collections. So your morning fasting, they give you a window from 6 a.m. to 8 a.m. Now that doesn't mean to take 2 hours to collect your sample. It does give you a little bit of a window, but the sooner you can collect, the better. But as far as that's concerned, also, you don't want any foam in your collection. It needs to be all saliva. Sometimes when you're in a hurry, you can start collecting the bubbles and the foam. You actually want straight saliva. So if you're struggling and you need to stimulate your salivary glands, you can do so by actually smelling vinegar. Or even something citrus that can help with the production, or something that you really enjoy. As long as you don't eat it, you can simply smell that to hopefully get some saliva forming for your sample. So if you look at the vial here, again, it's very hard to see because of the glare, but there is a top line right here that says 5 ml. That is as much saliva as you need to fill in the tube. No foam, straight saliva, but you would fill it to that line that says 5 ml. And again, seal on really tight, make sure it's not loose. Here it's gonna say the name, you're gonna write your date of birth, and you can even put the time if you'd like. Let's say it's 7:30 a.m. And then you're gonna put that in the refrigerator. Looking at the form again, we're gonna look at the second test here, the noon test. So again, it gives you a 2-hour window, 11 to 1. So with this test in particular, you are going to purposely eat 75 grams 1 hour prior to the collection of the saliva. So this is the one that's a little bit different than the others. It does tell you right here, 75 grams of carbs. So that can be equivalent to even just 2 apples. I know that you're on a specific meal plan. You can't have just anything, and we don't want you to just have anything. But you would be cleared to have 2 apples 1 hour prior to your noon collection. Remember, right before you start your collection, rinse your mouth out with some water, and then you would collect your 5 mLs and put that in the refrigerator with your name, date of birth labeled. But that one is set aside a little bit different, where they do want you to eat those 75 grams of carbs. Afternoon, we've got noted here from 4 to 5 p.m. So again, try to collect that, make that collection as soon as you can. This one's broken down to just an hour's time. But again, we don't want you to try to take an hour to do this. You want to try to get it done as soon as possible without any foam. And then of course the midnight collection. Now that time frame's from 10 to midnight, so that means you don't have to stay up all night waiting to leave your sample. And collect that, name, date of birth, refrigerate that as well. You'll see this portion right here. I usually tell patients to fill that out. I believe they have that there just for clarification, to see if everything matches up with what's needed. I guess if it didn't, maybe that could explain maybe some results and some, differences in some readings. So you can simply fill that out. Like for instance, the noon sample. If you were to collect your saliva at 11, well, that means at 10 a.m. you would have had your apples. So you would put 10 a.m. as far as the noon sample goes, because you were told to have that at the hour prior. Same here in the afternoon, 4 to 5. For the afternoon, they're just asking your last meal or snack. Well, nothing before an hour. So let's say you collected at 4. So let's say 2:30 you had your sandwich. So you could put 2:30 p.m. for your sandwich. But you can fill in those blank spots there. And then we went over this form already here. I'm just double checking, I'm sorry. There's one spot for the the stool collection. It does have ask you to mark your date of your first sample and the date of the second sample, which would be the very last day there too. So I usually have patients fill that out. So just a little bit of filling things out here. That's about it for the test itself. So after you've collected everything, you would simply put them in their bags, making sure your lids are on tight. Everything's been refrigerated, of course. And then you put them in the box here, fold up your form, make sure that you've filled out the appropriate things here, close the lid up, and then you've got your packing slip, so you just peel that off, that adhesive will stick, wrap it right around the side here, and then you fill out the front portion of the box with your information, your name, the date, city, state, zip code, and then this goes to UPS. It won't go to anywhere but UPS, so you just simply want to take that probably right in the morning, just to have that sent out. And again, course of 3 days in total, and I usually do recommend patients start Friday. So Friday the first stool sample, Saturday the saliva sample, Sunday the last stool sample, mail out Monday. If you have any questions, always don't be hesitant to give us a call. Thank you.